Think about how, say, a master chef teaches someone. It's not just the recipe, is it? It's all those little things, the wrist flick, the exact moment something changes color.
Exactly. The feel, the intuition.
Right. And now imagine that, but for surgery, lives are literally on the line. But traditionally, getting that deep expertise across, it's slow. You pretty much have to be there.
Which immediately creates problems, globally speaking. Huge disparities. Access to the best techniques is, well, it's still a massive issue in so many places.
But what if you could capture all that visual nuance and then, crucially, analyze it, share it in a way that just blows past borders?
And that's precisely what we're digging into today. This whole idea of surgical video, but not just raw video. It's the annotation, the analysis, how that can, well, democratize surgical skills.
Yeah, and we've got some really interesting material to work with. There's this PubMed article, right, about annotating neurosurgery videos for machine learning.
That's the one, a guide to annotation of neurosurgical interoperative video. It's quite specific, and we're pairing that with something seemingly different, an MRI brain atlas. Super detailed anatomical stuff.
Atlas of regional anatomy of the brain using MRI, yeah.
But the fascinating thing is how they both point to the same need. Detailed, enhanced visual information, making sense of what we see, whether it's for AI or for a surgeon learning on the other side of the world.
So for you listening, understanding this gives you a real window into, well, the future of how surgeons will train, how they'll collaborate. Oh, wait, someone wants to join. Hey, go for it.
Thank you for letting me in. I would like to stress the significance of discussing the anatomy related to the specific trajectory used in the chosen surgical approach. This will guide us toward understanding the sequence in which the anatomical structures appear.
That's a really insightful point. It's not just about knowing what's there, but how to get there safely and effectively. The path matters just as much as the destination, doesn't it?
Absolutely. It's the difference between reading a map and actually navigating the terrain. Knowing the landmarks is one thing, but understanding the route, the angles, the potential obstacles, that's crucial in surgery.
It's all about choosing the right perspective to visualize the trajectory you need.
Right. It's not just a generic view. It's about seeing what's relevant for the specific surgical approach. So with that in mind, let's think about why the traditional ways of sharing surgical know-how haven't fully captured this trajectory aspect, especially globally.
Well, the classic methods observing surgery, textbooks, even like live demos, they are the foundation, of course, but they have built-in limitations for widespread sharing. This focus on the how to get there.
Like being in the OR. You see the steps, but maybe not the subtle adjustments in the path.
Exactly. Direct observation is amazing, but you have to be there. And even then, what you learn about the critical trajectory can be a bit hit or miss, subjective.
Sure, one trainee sees one angle of approach, another focuses on a different part of the procedure. The trajectory tower, you put it, might not be clearly emphasized.
I should also point out that the surgeons in the midst of the procedure has no time to comment on the critical structures and decisions they should make. Each moment is a delicate balance, a dance with precision and uncertainty.
That's a really important thing to highlight. The focus during surgery is, understandably, on the procedure itself. There often isn't the opportunity for detailed commentary in real time.
Absolutely. The surgeon's priority is the patient's well-being and a successful outcome. Explaining every nuance as it happens isn't practical in the high-stakes environment.
But that's precisely why these annotated videos we're talking about become so valuable. They offer that chance to dissect the details after the fact when there's time for reflection.
What's fascinating here is how video can capture so much more than just the steps of the surgery. It gets those fine motor skills involved in navigating a specific path.
Right, you see how tissues react second by second. You can almost feel the instrument movement along that trajectory. It's the critical thinking playing out in real-time decisions about the route.
Exactly. It's stuff that's incredibly hard to describe in words or show in a static picture. So these videos become potentially powerful learning tools.
Hugely powerful. As we said before, they could be immersive, even allowing repeated viewing and analysis of the chosen path.